Not like the Japanese. They get used to the earthquake.
Well, we get used to it out here too. So we don't get a lot of them. We do get some small ones, but there's a big fault line right off the coast of Oregon. So there's always the predictions are there will be a massive earthquake off the coast of Oregon or Washington sometime in the next 20 years that's going to take out most of the Oregon coast, they think. So we're always waiting for the big one.
Okay.
Luckily, we don't have any emergency support services in the United States anymore, so we'll be fine. Sorry.
I think the latest is in LA, right? In Los Angeles.
All up and down the West Coast. So the fault goes from like San Diego through LA, through San Francisco, and then it goes off the coast.
Oh.
Prof, we have a few people from your side join already. Should we start now?
I think we're waiting for, did Jess join us yet? Yep, there she is.
สวัสดีครับสวัสดีครับ
I know Dr. Jessica, Dr. Alicia is sick today, and I do not believe she'll be joining us.
Okay. Okay. Okay, good. So today the our topic is regarding our training program regarding the basic simulation facilitator training course, and we would like you to have the comment on what should we focus on, and we have the newest developed by Dr. Dean. He used the AI in the basic simulation training in the group 5, and I think he have done a couple classes in the last 2 years. So today we will start with his training, and then at the end of this discussion, we will ask you regarding the SIMFA evaluation that now we use the dash and all the document regarding the course syllabus of our basic simulation training and AI augment simulation SIMFA training, and the dash evaluation sheet we sent to you already. So no need to present. But today, Dr. Dean have the slide to present his AI program. Okay, Dr. Dean, please.
Ajahn เห็นสไลด์ไหมครับ
Yes, we see ค่ะ
โอเค
But
Yes,
please,
yes.
but please make it full screen.
full screen อ๋อนี่ full screen mode นี่ Okay let me start with the present for the course of simulation facilitator we use the mnemonics like a gimmicks because of we set up this program for the last year. We start at the group 5 Phaya Thai Hospital. But that time accidentally we have the participant about 40 sim facilitator is accidental because we didn't ask them how many participants. We redesign the accidental program is from the many SIMFA because we would like to make sure everyone have can create the self simulation scenario and they can debriefing effectively. That is the why we have this course we present now. But today, not only for present for the course design, but also I would like to present after training because now we have the problem because when we training already, some of them cannot go to use simulation in their department. Now today we will discuss the program and after program for discussion for today, because we don't want to training just the individual skill, but I would like to integrate simulation culture in their hospital, because now group 5 already 100 simulation facilitator. That is a big amount of SIMFA. Okay, I will show about schedule. The schedule of training, we training for 3 days, but we adjust for the basic SIMFA facilitator program, because some hospital don't have simulation center, but they can use just an inside tool. We cut something just as simulation tour or Moulage or anything is because we would like to emphasize the debriefing, because the debriefing is the heart of the simulation. That we show you about the schedule for day 1, about a definition and everything knowledge for the simulation, and how to choose the program to their department, like a gap analysis and prioritization scenario. If they have the problem, simulation can fix the problem or use the another way to fix that problem, because the simulation don't can fix anything. They choose know how to use simulation correctly. And then we talk about how to create scenario with the AI. We use the ChatGPT for the prompt of the program. The AI help us to create the scenario design, because we have the template already. But I don't training by AI first, but I train for fundamental to know concept, objective, scenario for debriefing point, reference, and hurdle. We train up your the OHSU, the training. We train that for fundamental first, and then they have the basics. We upgrade to the AI, because we would like they know how to use effectively. And for the afternoon session, we train about Pearl debriefing. And the program this we will show about video to they pretend to in the video scenario and try to debriefing video. For example, we have the video just the routine operation. That is the common in the anesthesia program. That is cannot fix the problem for difficult airway, and we have the video for proper the learner. That I will talk you about. We have the small part different in this video, because sometimes we have the nurse to the SIMFA. Some course of Payathai Hospital have the physical therapist or radiology technician or pharmacist. We have the different video to proper their work. Okay, this is for day 2. Day 2 we practice for the all process of simulation by use the ART scenario, or sometimes use the stroke, something like that. We practice the all process. That just the start to greeting, gown room, and consent form, and pre-brief, and room orientation, sim theater, and debriefing. Okay. For standard dive form, make sure everyone can do correctly for the follow the step of simulation. And afternoon session, we create their scenario. In the basic simulation program that we do a long time ago, we just one group for case, but for one new workshop, we one by one. But it's like a homework that they should finish after they finish the class. The third one, the third day, they run their scenario. We got the problem because the old program have the make scenario to the another group to do the simulation. That is sometimes the another group don't comfortable because knowledge. Sometimes who decide, who make the simulation is different the knowledge. We change this day to the dialan for alpha dialan. For the desk group can dialan their scenario. Don't have this problem for knowledge and skill. This is for before finish class, we have the post test 70%, and they must send the one scenario for one person.
So Dr. D, so the same team that designed the scenario are they running it, or are they the participants in this scenario?
Yes, the same team.
So how many people on our team, because they need practice both running it and participating as well? So if there's not enough, like either you have teams that are very large, like 9 people, so 4 are in the scenario and 4 are running it.
For one group, it's about 6 to 8 person. It's about 8 person per group.
Is it a stage scenario so that they could switch? So like maybe the first half of the scenario, half the people run it, the other half participate, and then for the other half, they could switch, because you need experience both seeing what it's like to be in the scenario, but you also need experience running it as well and being the observer.
Okay, thank you, Dr. Jeff. I will switch follow your suggestion. Thank you.
I don't know, Jess, any thoughts? Steph, Lish?
I agree. I had the same question. And I was just putting it in the chat for Dr. Dean to see it as well. No, it's just same question. I'm just, so he'll have it. And I was curious, Dr. Dean, to hear about what you do in your dry run. You said a dry run?
Yes, dry run.
What do you do in your dry run?
I do the dry run. They show the all process for the pre-brief and scene theater and debriefing, and for effective the dry run, how about create the scenario creation and scenario flow and debriefing for the dry run. So,
okay, thank you.
Yeah, you. Okay.
ต่อเลยครับอาจารย์ดีนเดี๋ยวมันจะไม่ทันครับเหลือ5 นาทีครับเหลือ5 นาทีเองครับ
เหลือ5 นาทีโอเคครับ Okay, this is a summary because we have separate tag nurse and med support for this class because something is different. Okay. This is the conclusion for the different program, for BDMS basics and the new program. We emphasize the debriefing for 10 sessions for this course, and we create the case one by one. We separate nurse and med support, and we use the AI and assessment to written exam and senior submission. The gap analysis is for this course we don't have the post-course support for their simulation facilitator, because simulation some hospital are not link QI for patient safety. that is for the already training. They don't train anymore. They have the knowledge for themselves, but they don't use the simulation for their hospital. This is we create the post support. This is we talk already AI support. Okay, the post course we have the KPI for they make sure they have can create simulation or their department. For example, they choose do simulations scenario for 2 cases for 3 months, and they choose we have the senior sim facilitator to feedback them in the dash of per observation, and they have the feedback for learner, and they choose record the debriefing video for faculty for feedback them. This is for KPI for monitoring, for make sure them have make the simulation. But this is should be HR human resource to support to give the timing of working for them they can follow this KPI, because of they don't have the job description where then they go back after training. Okay, this is the step. They choose the pilot project, ER, ICU, pharmacy, and to start it easy. It's like a mini sim, as like a inside to low cost. It's easy today can do in their department. They submit log submission, and we have the sim governance to review their monthly. We have already this committee. Okay, this is for conclusion. They should link for the KPI and quality improvement for their job, for incident report or anything they have a gap. Okay, mini sim already, sim governance already. Recognize system should be done, because some hospitals don't know simulation. What is it? What is make it? We should give the knowledge for the top of the nurse and executive to know about use simulation today, and impact for RCA safety. Okay, and link this for simulation. Looking forward, we should expand our BDMS have this program and have the post training program too, because we choose integrate simulation to each hospital, and we create the dashboard for tracking simulation facilitator who complete training. This is, for example, we design. This is the first graph is a number of simulation for each month. If it's growth, it's very good. This is department. This is the third graph is like how about a learner write the simulation like a feedback program, and then debrief to the debriefing score is like a radar timing, debriefing step, feedback, supporting, focus, something like that. Thank you. 20 นาที that. Okay, any suggestion?
Okay, thank you very much. So before we go to the discussion part, I would like to Kun Siam Manachaya to present her experience, the real experience in Payathai Hospital, that she is the host to do the training at Payathai 2 Hospital. And I think at the end of this year, when you come to Thailand, we can visit her simulation, the new one, that very nice structure. Right now, she has the job to train more simfa to do more simulation in Payathai group. Okay. คุณเสียมพร้อมไหมครับ โอเค Hi
Hi
Good morning.
everyone. Thank you อาจารย์ไพศาลนะคะ ก็ I would like to present about after finish the course of the trainer by AI by Dr. Dean. Profile just mean Payathai and Paulo Hospital. was conduct the course that have the AI to help to create the scenario since last year. Last year, we have conduct only one course that one course. Okay, it's not this slide. Okay, so sorry. One course. I missed nurse and allied health around 37 participants in this course. That means nurse, pharmacists, radiology, technologists, and physical therapists. That's mixed for last year. And next for this year, we separate for two courses. The first for the allied health, example pharmacists, radiology, technologists, and physical therapists. We will conduct on February this year. It have participants 32. At another one course in this year for only nurse, we held from last month and have the 31 participants. And now include the total number of participants of complete the certified AI integrate healthcare simulation facilitator program from Payathai and Paulo Group. It have around 100 persons. This certified from the course from Group 5. That another one, it have the SIMFA that certified from BDMS and OHSU is not included. So it means it have more than 100 SIMFA in Group 5 now. Post-training, individual who success complete the training from the course will be coordinated with Kun A. Kun A, if we have she will have the schedule for the Group 5 and show to everyone if the SIMFA can to be joined. SIMFA of is we will join and go on each side of hospital. And after the finish the course, we will evaluate SIMFA by debrief on debrief only and to providing feedback what is the good thing that they do or what is the something to development for in the future. Okay, this slide show for course in this year for the first course for allied health นะคะก็
มันเหมือนสไลด์มันไม่เคลื่อนหรือเปล่าฮะ
อ๋อไม่เป็นไร
มันยังเป็นความพึงพอใจ 99.2% อยู่โอเค
Okay, and for this slide show about the course for nurse in this year, we have the nurse to attend around 31, okay, and have the satisfaction 100% for this course. Okay, for me only this. Thank you for suggestion and question.
Okay.
What specialties are at Piatai? So is it specific COEs or all of them? I did not capture that.
Actually, I think the learner is not in the COE, but they have the training for, I think, nurses and paramed. This is non-MD, and they have the special class for the nurse.
Got it. But are these nurses? And again, was this about? And I got a little confused, so I am sorry. This was training the nurses or training more SIMFA or both?
I think right now the role of Kun Siem in G5 in the group 5 is under the nurse organization, the NSO and the HR. So their job is like doing more in the training under HR. And
then, but like, is it all nurses? Is it specific areas? Or are they just general foundational skills that all nurses need to know? So I couldn't get a good idea of what was the topic of the simulations.
คุณเสียมเขาถามว่าคนที่เข้ามาเรียนเนี่ยมันเป็นกลุ่มเฉพาะหรือว่าเรามีอะไรที่มันเป็นobjective ของ training หรือว่าเป็นแค่ general training ครับ
คือ the first one target group is the nurse educator of each hospital.
Got it. Okay.
And the senior nurse, because in job description of senior nurse have the coaching or for the training in mentorship of the junior.
Okay, I understand.
Excuse me, because group 5 we have the 11 hospital. For each hospital, send for 3 person for each hospital. Because we have 11 hospital.
Got it. Okay, now I'm understanding it. Thank you.
Okay, now I think we come to another section before we go to the discussion at the end. We sent you the our the recently current dashboard evaluation form. ไม่เอาไฟล์ขึ้นมาได้ไหมไอตัว dash อะที่เราส่งไว้ให้เขาอะที่เมื่อวานผมบอกให้เตรียมไว้ So my question is now we use the dashboard that developed by Dr. Montri and the Simfa team several years ago, and now we still use this. But my question is there any update? So this is the whole picture of the training and evaluation for the Simfa system in BDMS Sim Center. And I just want to get some comment. If you say that it's fine, we can use this for the next couple years, that is okay. But if you think that okay, our form need to be updated, please comment. Yeah, that's it. Okay, I think we come to the section of the discussion. Okay, this is the evaluation by the dash form that we generate I think more than 8 years ago. Okay, my scroll down ไปเร็วๆก็ได้ครับ We can do I think 5 elements. Yeah, and the score rate is 1 to 7. Okay, the second element. And the third element, the debrief.
Jessica, you are much more up to date on this than I am. I don't know if Dash has really changed that much. Is there a new version of it? Like, I'm not aware of it, but I also don't keep up with it as much either.
I don't think so. I mean, it looks like the revision down here is that the October 28th, 2024. Is that when they pulled it off of the website? Because you can go back and get, if they have an updated version, it would be there, and I can look.
Because the edition is from 2011.
I mean, what I would say is, unless there is a really good reason to change it, What's more important is that you have consistency in the same tool that you're using over time to allow you to see the impact of what you're doing. So if all of a sudden you change your dash tool and you're changing your train the trainer curriculum, then you don't know whether the changes to your curriculum are making things better or worse, because the outcome of your curriculum, that endpoint is also changing. It's sort of like if all of a sudden you had to decide whether your blood pressure medications are working or not, but you changed the definition of hypertension halfway through.
Okay ไม่เอาไฟล์นี้ลงก็ได้ครับเปิดเป็น so we go to the free discussion start with the
And what
presentation of Dr. Dean that a lot of question in the chat.
So Dr. Paisa, one
Yeah.
thing I would say with that, when you're doing your reaccreditation, your IMSH reaccreditation, I think you could be very explicit saying we are using these tools and we are using these same ones because we feel it's important to have consistency with our measurement outcomes as we have changed our train the trainer course.
Okay. Actually, I have to say that mainly in BDMS Sim Center, we don't have the this new training yet, but because we still run the same basic train the trainer course for the SimFa and the SimOp as we present last year, and for the new AI course is in only the group 5. So
Okay.
This is some different that we need to get some comment, and I think until next year we still in BDMS Sim Center we still use the same system, okay, because we have to re-verify the SSH in 2026, and every indicator and the KPI I will keep in the same for the comparison and the presentation. And after that, maybe if we want to change, we want to share the new program into the best situation before we change the training program. That's why I need the input and the comment for the new one that they have launched since last year. But I think we still have some different and some area of the improvement that we need your comment. So the problem I think we have to discuss is should the learner learn the basic SimFa before, and the next step we apply the AI and do like the bigger group like this, or we should start with the new program for the beginner because in G5 they have a lot of nurse educator, and some nurse educator even though in BHQ the skill of the SimFa is very important for teaching and coaching. It's not like the teacher, but we coach, and if all the nurse come to learn how to be the good SimFa and use that technique in training, I think it will be have a lot of benefit. But this is not focused in the MD group yet, because I think it's hard to find the doctor to be the SimFa in the private hospital. So if you look at the course that Dr. Dean present, I think there's a lot of question. Maybe Dr. Dean.
So I have some thoughts, but I want to make sure I give Steph, Jess, Lish a chance. I don't know, is Lish still here? Steph and Jess at least a chance to talk. There's Lish. I just found your head. A chance to comment as well.
Because Jessica just type your question. Do group rotate through 3 roles or station? The running, the participating in it, the group debrief, and the observation, the group debrief.
Yeah, we answered that one. I think Jessica just put in my question that I had asked earlier. But what I was going to say is, if I'm understanding what you're saying, Dr. Paisal, you have a lot of people who need to train. Does everyone need to go through the whole big course? And what I would say is I think you may want to have levels or tiers of SIMFA. So for example, just because you have to train 1,000 people, you may only need to develop 3 scenarios to do that, right? It's the same scenario that all 1,000 people get. So the number of people that need to know and be really good at designing a scenario is not nearly as many as the number of people that you need who know how to run a scenario and debrief a scenario. So for example, just like we have SimOps specialists whose job it is to really learn how to manage the technology, moulage, and set up the room, you could have part 1 of the course for a smaller number of learners that are the ones who know how to design scenarios. And then that they can learn how to do it for real and with a little bit of AI. Then your larger group of learners are the ones that you really train on how to run scenarios, observe behavior, and do debriefing. And that's the core skill that all SIMFA get. So you have like a basic SIMFA who can run a scenario and do a debrief. Then you have advanced SIMFA who know how to design scenarios, and they get a little bit of extra training in a course just for that. And then you have SimOps, which is its own little add-on. Does that make sense? Because it may not, if you have a lot of people to train, teaching everyone how to design scenarios may not be a good use of time, because you're not going to make that many scenarios because of the number of people you need to treat. You can restrict that to a core to create the library, and then let everyone else just learn how to use the books, use the library. I don't know. Does that make sense? Jess, Steph, Lish?
I was I think that makes a lot of sense, because I was also curious, how are you going to create and train that many people across the system? So having like a smaller, to your point, maybe resource team or team, whatever you want to call it, at each location that is running, that can do to your point, the running and debriefing. But then your more advanced group, perhaps, that is that train the trainer, that's doing that bigger kind of assessment part of it also, and debriefing of the debriefings. And then SimOps. So I'm not clear what the current structure is, but yeah, having that train the trainer. Mm-hmm.
Yeah, that's kind of how I was envisioning it too, if I understood right. Not every one of we keep saying 1,000 people. I have no idea how many people actually.
Oh, I just made that up. I don't know.
But there's going to be, everybody needs to be a participant at some point, but there's going to be a smaller subset of people who are going to be the trainers who'll be trained in debriefing. They'll be participants at one point, then they'll be trainers. They'll get feedback and debriefing on being debriefers and leaders, if that makes sense. And those are the people who will continue to run these on a long-term basis. And I expect over time, some of the people who participated as like the basic participants may want to become trainers, but you don't have to do all of them. I don't know the magnitude of this. It's really cool though.
So in my understanding, I think for the SIMFA trainer and the learner, for the one who is the beginner, should train in the not sophisticated and complicated situation, and then when they get the skill of the basic SIMFA, next step we can do the second for the one who have the more competent and more experience and can add on the more advanced skill. So we should classify to be 1 or 3 step of the training, right?
Yeah. So
Everything in the not everything in the same basic sim from basic to advanced in one course. That's not good, right?
it may be a little bit much. And so this is what I'm thinking about. This is terrible. Well, okay, it's really bad. But you get the idea that
Wow.
the biggest group of people you have are ones that know how to do debriefing and observation. They know how to give feedback. They know how to watch. They know they are your clinical. They know how to do things clinically and now apply their clinical skill to simulation. Then some of those people are going to be good enough to actually help give instruction in the control room, how to do things day to day, how to do things to really run the simulation. Then some people are going to be even more advanced in this next circle where they're going to be writing the scenarios. They're going to be doing your dry runs. They're going to be designing your pre-brief. And then you have your super people who are, this should be SIMFA trainer, sorry. They're the ones that are doing all the other training at these other levels. They train everybody else. So like Dr. Dean would be here, but you may have a brand new nurse who the first thing all you do is you teach them what is debriefing, right? How do you give feedback? How do you, because that's the core skill that everyone needs to learn, and you work your way up. Now, everyone needs to understand a little bit of how to design a scenario and everything else, but they don't need to be expert at it. Just enough to get knowledge, but really practice your way through these stages. I don't know, does that make sense? Besides the fact that it's kind of like messy and I just made it, so there we go.
It's fancy.
Yeah, well.
And then
I really appreciate your
sim ops.
do the cartoon, the graphic very fast.
And we got to merge sim ops in there.
I was gonna say that was my question, and for Lish too, like within sim ops, you know, that is kind of within each of those levels. So maybe it is by function. Knowing that depending on the size of a location, you might have someone who is both.
Yeah.
Might be a one person show.
So it mean it will go to the criteria for select the learner too, right? Because of the learner should know that what is the objective for the learning and the training.
Yep.
Mm-hmm. Jeff, I really like how you set this up, and I can see each of these 4 categories having like a list on the side of what the skills for that group are needed, and everything's cumulative. I love that you said that sort of the debriefing observation. I think that debriefing with good judgment is such a key and core skill that is not always obvious. You know, sort of people give a lot of feedback, but that doesn't mean they're actually debriefing with that sort of good judgment, which is how the participants leave with what we want them to, I think. So this is really good.
There is there. Sorry, I'll stop sharing.
Oh, somebody just, oh, Jess, thanks for posting that.
I just added a note for Dr. Dean in your presentation. It's listed as the Pearl technique, and you'll want to describe that as the Pearl's debriefing tool. And there's an S at the end. If that makes sense.
Yes.
And then the other piece, when you're looking at the language that you're describing, the different definitions, there is a new simulation, healthcare simulation dictionary that was published. So I'm putting that in here as well for you.
Oh, thanks, Jess.
Maybe we have to discuss more at the BDMS Sim Center that we categorize the level of the SimFA training for the beginner, and we set the set of the course that appropriate for them because they may be very new. But for the one who is the nurse, who is the educator already, they may need just a little bit of change and learn how to do the coaching and the pulse principle and change the behavior of the teaching, not too strong, right? And then we can categorize another group that have experience like 1 year already, and then they come to update and learn the advanced skill, like using the AI to create more and how to be the senior SimFA to coach the junior SimFA in their organization. Maybe this is my idea that I thinking why I get the idea of Dr. Goals by his graphic.
Yeah, I mean, there's a lot of ways to do it, but I think, you know, we've always said from the very beginning, define your learning objectives and choose the right technology. You don't always need a high fidelity mannequin. Sometimes you just need a task trainer. It's the same thing with what you're trying to do with your train the trainer course. You have to say, all right, how big of a workforce do I need? And does everyone in the workforce need to have every skill? Or are there certain skills that you need from more people than others? So I think Stephanie would say, like when she does her ventilator simulation, where you sometimes really need help, you could have 1 or 2 core people run the sim. You only need one person to design the sim. That's Dr. Nonis. You could have 1 or 2 people run it with Dr. Nonis and Lish, but you often need many faculty who are good at debriefing because you can't do all the debriefing yourself, right? Or if Dr. Nonis is working in the ICU, that she could give it to Dr. Hubble or Dr. Giovanni to just run the simulation and do the debriefing, but don't have to worry about designing it. So it's really about workforce development and making sure that you use what your scarce resources to be as strategic as possible as to how many you train and what you train them on.
Okay. Yes.
And make very pretty graphics.
And another question for the basic simulation, I think we can do like training for multi-professional come to learn together for the basic. But for the next step, for the one who have the experience, should we gather more similar career? Because if we have the X-ray people, we have the pharmacist, we have the nurse, we have the MD. Maybe it's very hard for us to adjust the cost, right?
I think,
Or we can do multi professional in the class.
I think where it's going to be more of an issue is not about the experience. It's not about the professional. It's going to be about the knowledge. So it's okay to have a pharmacist, a nurse, and a physician working together in an advanced course. But if the advanced course is about designing simulations, they all have to have some degree of similar medical knowledge so that they can really have So like it would almost be like cardiology COE is an advanced course versus trauma COE. You don't like that. I think may be more important than just having 5 physicians working together.
Yeah. And if I could pipe my 2 cents in, I've done
Please do, Steph.
I've done some interprofessional sims with the ventilators, for example. And one of the things that's very helpful is, we're all responsible for the patient who's on a ventilator. And in the US, that's generally the physician, the nurse, and the respiratory therapist. We have overlapping, but in some ways distinct roles. But a lot of my sims, when I do them interprofessional, are about building the fundamental teamwork part and training the team to information share, to have, sort of directed closed loop information. And, at the start, when I started doing these right before the pandemic, we had a lot of nurses who didn't feel as confident as we wanted speaking up, and even some respiratory therapists who were, I don't want to say afraid, but they didn't want to speak up in front of the doctors. But like that was a key part of this. And it's similar to when we run our Code Blue simulations, where we train people. You have to lean into your role, you have to own your role, and you have to do it in an authentic way, which is when the whole team is together. So there is a huge value to training us individually, but then we want to train and have the sims reflect our actual practice if we can. That would be my sort of 2 cents on interprofessional sims. I love them. They do take a little more thought because your learning objectives will include potentially ones specific to each profession, but also as a team, did you achieve this? Did you achieve what you wanted to? Thoughts, Jess? I know.
Dr. Dean, do you have any discussion question or point?
Okay, thank you for Dr. Jeff. Slide, your quick slide is very impressive. I know what we work to correct data because we have the problem some competency in some nurse to get to keep competency of SIMPA. We need to have keep the data of simulations program that they run in the month of or in the year to keep competency to develop scenario for the keep debriefing session, because we should have the level of simulation facilitator basic or advanced, because if we don't keep this data, we don't know who basic, who advanced. That is, we start now to the next program, post training of simulation program. Thank you.
We have 5 minutes left, Ajahn Paisan. Anything else you want to say?
I think today we have learned a lot and from OHSU team, and I have to congratulate to the group 5 that you get a lot of the input to do the more advanced in your training. And in my opinion, I think we are start a new chapter, especially after next renew the certificate in 2026. And good news is now we have the official BDMS, SIMFA, and SIMOP working team that come from many members that just came back from OHSU last year, and also the senior SIMFA like Kun Anusa, Kun Lawan. Yeah, they will come to work together as an official, and then we will do more in the official training and approve the course and approving the site that we gonna have the some node more in the future. So I think we still need a lot of support, either from IAC and from OHSU.
mostly OHSU อาจารย์เราไม่มี expertise ช่วยได้แต่ ประสาน
Yeah,
ไป
yeah.
มา
I think the only problem in Thailand is we don't have like the full-time Simfa work like the 0.75 FTE. We don't have it. Yeah, we just need more personnel to work in the simulation field. Yeah, but I think that's not no problem. We do more and we get more people in the future, I believe.
I agree.
So for the last couple of minutes, anyone want to comment? And looking forward to see you in December.
Yeah, no, we're really excited. It's gonna be good.
Yeah.
someone send the heart anyway
That was from our cardiology COE.
okay thank you
อาจารย์
everyone
มา
and have a
ครับ
Thank you.
Thank you
Thank
very much. Thank you very much,
Everyone,
everyone.
thank you so much.
Yeah.
Stay
Have a
safe, everybody.
Thank you for
safe
presenting.
everyone.
Good to see you.
Bye bye. Thank you very much for your time. ขอบคุณทุกคนนะครับที่เข้ามาวันนี้นะครับ
Bye.
Bye.